Good morning to all of you, to Gisela, to our sign language interpreter, and to all of those following us from different places. Excuse me while I remove my face mask. Today, 551 people are hospitalized in Cuba. 20 are under observation. There are 291 suspected cases and 240 confirmed active cases. In our primary healthcare system, 6,466 people continue to be monitored by our professionals and specialists. Yesterday, over 3,000 samples were processed, a number that will increase over coming days. 3,732 samples were processed in our various molecular biology laboratories yesterday. 1,501 were processed at the Pedro Curi Tropical Medicine Institute, 712 in Havana's Hygiene, Epidemiology and Microbiology Center, 308 in Villa Claras, 280 in Santiago de Cubas, 411 in the Genetic Engineering and Biotechnology Center Lab, 301 in the Hermanos and Mujeres Hospital Laboratory, and 219 in the Civil Defense Laboratories. Of the 3,732 samples processed, 25 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 281,595, of which 2,726, or 0.97%, have tested positive for the virus. Yesterday, samples were tested from all of the country's provinces. 143 from Artemisa, which is dealing with a complex epidemiological situation. 1,512 from Havana, 228 from Matanzas, 223 from Villa Clara, 98 from Ciego de Ávila, 95 from Holguín, and so on and so forth from all of the country's provinces. The 25 positive cases diagnosed yesterday are all Cubans, a trend we have been seeing over recent days. 21 or 84% of positive cases yesterday are confirmed case contacts. This brings the total number of confirmed case contacts to 1,320, or 86.5% of all diagnosed cases. Of the 25 cases diagnosed yesterday, the source of infection linked to 2 cases is yet to be determined. This brings the total number of cases where it has not been possible to determine the source of infection in Cuba to 134, or 4.9% of all confirmed cases. Meanwhile, 2 people contracted the virus abroad, taking the total number of imported cases to 229. 16 people diagnosed yesterday are male, for 50.3% of all cases, while 9 are female, representing 49.7% of all diagnosed cases. As we can see, the rate is almost the same for both sexes. 15 of the 25, or 70%, were asymptomatic at the time of testing. These cases account for 55.6% of all positive cases on the island. When we look at this figure over the last 15 days, it rises to 63.1%. The absence of symptoms makes the virus extremely dangerous, and among other things, like being highly infectious, has also made it extremely difficult to control on a global scale. Of the 25 positive cases yesterday, 11 are between 20 and 39 years of age. 11 are also between 40 and 59 years of age, and one is over the age of 60. Yesterday, 2 individuals under the age of 20 were also diagnosed with the virus, bringing the total number of patients in this age group to test positive for COVID-19 to 310, all of whom have responded well to treatment, meaning that 281, or 90.6%, have been discharged from hospital. Of the 25 confirmed cases, 10 are from Havana, from the municipalities of La Lisa, Marianao, Habana del Este, Plaza, and Boyeros. 13 are from Artemisa, and the municipalities of Bauta, San Antonio, San Cristobal, Caimito, Artemisa, and Mariel. There were 2 imported cases yesterday, one from Cienfuegos and the other from Guantanamo. You'll notice, looking at the location of these cases, that the majority are linked to outbreaks or cases we have previously reported on in these briefings, and that are being managed with restrictions being applied and more people being screened for the virus. Above all, confirmed case contacts, but also anyone else who could potentially be linked to these episodes of local transmission. Therefore, yesterday's result by province, and excluding imported cases which do not count toward Cuba's confirmed case rate, means that Artemisa continues to have the highest rate of confirmed cases per 100,000 inhabitants over the last 15 days, standing at 20.39. Havana's rate also rises to 6.14. Villa Clara's rate remains relatively unchanged at 0.39. In the case of Pinar del Rio, where a person recently tested positive for COVID-19, the province has a rate of 0.17. Rigorous screening has therefore taken place in Pinar del Rio, with no new cases to report thus far. This means that Cuba's rate also increases to 2.23 per 100,000 inhabitants. Summing up, of the 2,726 people who have been diagnosed with the virus thus far in Cuba, 240, or 8.8%, are active hospitalized cases. This is a relatively high number when compared with rates seen over previous days. Of the 240, 238, or 99.2%, are clinically stable. No deaths were reported yesterday in Cuba. Since the pandemic began, the island has registered 87 deaths, for a mortality rate of 3.22%, which, compared with the regional rate of 3.73%, places Cuba in 21st position in the Americas. Compared with the global mortality rate of 3.79%, Cuba places 113th in the world. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, although more people were diagnosed with the virus than were discharged from hospital, there was still a higher number of discharges than we have seen over recent days, 14 to be exact, 8 from Artemisa and 6 from Havana. This means that to date, 2,396 people have recovered from the virus in Cuba, representing 88% of all confirmed cases. You will recall that the patient from Havana being treated at the Dr. Luis Diaz Soto Hospital was initially reported as critical, then critical but stable, then serious, and yesterday as stable and is being closely monitored. That is to say, her recovery has been positive given the treatment and care that she has received. However, 2 patients, also from Havana, were reported as serious and are currently in intensive care. This is the situation in Cuba, where, I stress, we have seen an increase in cases, and we hope, through the measures that have been implemented, combined with the participation and responsible behavior of citizens, that we will be able to reverse the situation, which, I repeat, represents a great risk to our country, especially given all the measures that have been taken and the management of the pandemic, which, because of the careless behavior of some individuals who do not seem to understand what the virus means and what it means for Cuba, has recently resulted in an increase in cases. Now, we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. The total number of COVID-19 cases worldwide currently stands at 18,263,542, after 207,232 people were diagnosed with the virus yesterday. Yesterday, over 4,000 people died of the virus, 4,507 to be exact, for a total of 693,726 COVID-19 fatalities and a mortality rate of 3.79%. The region of the Americas, which continues to be the epicenter of the pandemic and has been now for many weeks, accounts for 53.97% of all COVID-19 cases worldwide, after 95,129 new cases were reported yesterday, for a total of 9,857,801 confirmed cases. 2,270 people died of the virus in the region yesterday, bringing the COVID-19 death toll in the Americas to 367,958 and a mortality rate of 3.73%. This is the information we have on the behavior of the pandemic in Cuba and across the world.